Hello, and welcome to the Preventing Lead Exposure in Home-Based Childcare webinar series, hosted by Childcare Aware of America, the National Association of Family Childcare, the Children's Environmental Health Network, Eco-Healthy Childcare, and the National Center for Healthy Housing. I'm Jessica Rose Malm from Childcare Aware of America, and we're excited to be partnering with all of these organizations to share information with you today about lead in paint and how you can take action to reduce the potential for exposure in your home-based childcare facility. Thank you so much for joining us. We recognize that free time is hard to come by, and we thank you for prioritizing the health and safety of the children in your childcare facility. Whether you're joining us live this evening, watching the recording during nap time, or finding another opportunity to learn more about the dangers of lead, we appreciate your commitment to protecting children from lead exposure. A few logistical notes. We're using GoToWebinar for this evening's session. If you've joined us today by phone, I encourage you to sign in to our meeting via your computer as well. We'll be sharing a slide deck outline, and you may want to follow along. To achieve optimal sound quality, we suggest using the teleconference feature. Because we want to make sure that everyone gets to bed on time tonight, we won't be answering questions live at the end of the webinar, but we encourage you to type your questions into the control panel located at the right of your screen during the webinar, and one of our presenters will send you a response within the next few weeks. During today's webinar, the first in a four-part series, we'll hear a little bit about the Lead-Safe Toolkit for home-based childcare. We'll learn about the dangers of lead, review a sample policy that you can put in place to help reduce exposure to lead-based paint in your childcare facility, and we'll share some tips on how to effectively implement that policy. Today we'll be learning about the steps you can take to reduce exposure to lead in paint, but there are other ways that you and your children and staff in your facility can be exposed to lead. The other webinars in this series will help you address how to reduce exposure to lead in drinking water, soil, and in consumer products like toys. All the webinars will be recorded and available online, and we encourage you to watch all four in the series. For those of you watching live, our colleagues at the National Association for Family Childcare are pleased to be able to offer training certificates for attending today's webinar. Proof of attendance will be sent via email within a week of the live webinar. Please check your junk or spam email folder, as it often gets automatically sorted there. If you haven't received your certificate within 1 week, please email NAFCC at the email address that will be shown at the end of today's webinar. To help us get started, let me introduce Hester Paul from the Children's Environmental Health Network, who will tell you a little bit about the toolkit.
Thank you, Jessica. My name is Hester Paul. I'm the National Director of our program called Eco-Healthy Childcare, housed within Children's Environmental Health Network. This webinar series is based on a toolkit that was designed to provide home-based or family childcare providers like you with resources and strategies to ensure the safety of their childcare facilities. It is available online at the link on your screen. Like the webinar series, the toolkit is divided into 4 main categories: how to avoid lead exposure from paint, drinking water, soil, and consumer products, plus a general resources section. Each of the 4 categories contains a sample policy that you can adopt for your business and share with the families you serve. We know that there's so much to keep up with on a daily basis when running a home-based childcare facility. In an effort to support home-based providers, we've created 4 lead-focused policies which detail best practice commitments that can be added to your parent handbook. Creating or adopting a policy ensures that a practice continues over time, regardless of whether or not you hire new additional staff. All staff should be on the same page about how to prevent lead exposures. Additionally, the families you serve may be interested in knowing how you worked to prevent lead exposure within your own home. You are welcome and encouraged to share these policies with the parents you serve so that they too can make similar changes within their own homes. Along with each policy is a worksheet to help you set the policy into action one step at a time. Each worksheet gives you valuable information about the importance of ensuring that homes are lead safe and gives approximate costs of the recommended steps to reduce lead exposure. These worksheets complement the policies. Each of the 4 categories, avoiding lead exposure from paint, drinking water, soil, and consumer products, have both a unique policy and a worksheet. The worksheets are longer documents, they're more comprehensive, and they offer detailed information as to how to go about making changes within your home so as to feel confident that you can uphold your policy. Links to the resources and contacts that you can consult as you implement the policy are also provided. As we've mentioned, today we'll be focusing on steps that you can take to reduce exposure from lead in paint. And to help us dive into this topic, let me welcome Amanda Reddy. Amanda Reddy is the Executive Director of the National Center for Healthy Housing, an organization dedicated to the idea that better housing can be a powerful platform for better health, and originally founded to tackle the issue of childhood lead poisoning. The National Center for Healthy Housing has been at the forefront of lead hazard control research and policy for at least 3 decades, and specializes in working with communities to find practical solutions to finding and fixing lead and other housing hazards.
Thank you, Hester, and thank you to all of you for taking the time to learn about lead in paint this evening. Lead can be found in all parts of our environment, the air, the soil, the water, and even inside our homes. Much of our exposure comes from human activities, including but not limited to the use of fossil fuels, the past use of leaded gasoline, some types of industrial facilities, and past use of lead-based paint in homes. Lead has also been used in a wide variety of products found in and around our homes. In addition to paint, this includes things like ceramics, pipes and plumbing materials, solders, gasoline, batteries, ammunition, cosmetics, children's toys, and more. However, one of the major sources, the key sources of exposure to lead, is lead-contaminated dust in our homes, and most of that dust comes from lead-based paint that has deteriorated, often from just regular wear and tear in a house, and that's why paint is the focus of the first webinar in this series. But let's step back for a minute and remind ourselves why it matters if children are exposed to lead and why your role as a child care provider is so important. Lead is particularly dangerous to children because their growing bodies absorb more lead than adults do, and their brains and nervous systems are more sensitive to the damaging effects of lead. And it doesn't take very much lead dust to create harm. Imagine, if you would, a standard sugar packet that you might use to sweeten a cup of coffee or a cup of tea. Now imagine that instead of sugar, that packet is filled with lead-contaminated dust. That's equivalent to about 1 gram of dust. Now imagine taking that 1 gram of dust and spreading it evenly over about a half of the area of a football field. That's still enough for the EPA to consider it a contaminated surface. That means that the amount of lead-contaminated dust it takes to harm a child is invisible to the naked eye. That's important, so I'll stop to emphasize that point. Sometimes when we say dust, people imagine big dust bunnies or a thick layer of dust on a surface, but you might not even be able to see the amount of lead-contaminated dust it takes to harm a child. That's why it's so important for you to know how to identify if you have a lead paint hazard in your home and what you can do to remove it. And we created this toolkit to help you do just that. The next obvious question is, if we can't see it, how do we get exposed to lead, and why are children at such great risk? In addition to being more sensitive to lead's harmful effects, babies and young children can also be more highly exposed to lead because they often put their hands and other objects that can have lead from dust or soil on them into their mouths. I have an active and curious 10-month-old at home, so I see this hand and mouth behavior firsthand every day, and I know all of you do too. Infants drinking formula are also in danger if the formula is made with lead-contaminated water. People may also be exposed to lead by eating and drinking food or water containing lead, or from dishes or glasses that contain lead, inhaling lead dust from lead-based paint or lead-contaminated soil, or from playing with toys with lead paint. So what happens when children are exposed? Very high doses of lead, which are rarely seen in the US today, can cause seizures, coma, and even death. However, even much lower levels, between 3 and 5 micrograms per deciliter in a child's blood, can lead to neurologic damage. including impaired memory and executive function, which is the ability to plan, remember instructions, and juggle multiple tasks. Such blood lead levels can also lead to decreased IQ and academic performance and can cause behavioral problems such as impulsivity, hyperactivity, and attention disorders. Some studies suggest that lead exposure may also cause antisocial behaviors or conduct disorders, depression, anxiety, and withdrawn behavior, which is the tendency to avoid the unfamiliar people, places, or situations. And it's important to note that even though lead is harmful in all of these different ways I just described, children who are exposed to these lower levels of lead won't appear sick. The only way to tell if a child has been exposed to lead is to have a blood test. The good news is that lead exposure is preventable. We know how to find sources of lead in your home, and we know how to fix them. You can start taking steps today to protect all of those in your care. And the best news is that the steps you take today can start having an impact immediately. And again, that's why we created the toolkit, to help childcare providers like you get started. As Hester mentioned already, the toolkit has a sample policy you can adopt to help you protect those in your care from lead paint hazards, and to help you communicate with parents and staff about lead and paint and the preventive steps you're taking to address it. There are 4 major components to the lead and paint policy included in the toolkit. The first 2 are listed on your screen now, and they ask you to commit to having your home inspected by a certified professional and to notifying parents and staff of the date and the results of the inspection. Screen now. Apply if the inspector finds lead hazards in your home. These parts of the policy provide guidance on how to safely address them by hiring certified professionals and how to work with your local health department or lead poisoning prevention program to create a plan to address any lead hazards that are identified. In addition to the general policy statement on lead-based paint, the toolkit has a worksheet that contains 5 simple steps, each with detailed instructions on how to implement the lead and paint policy, which we'll go over in just a moment. We suggest that you review and fill out the worksheet once a year and keep it in your family handbook so that you, your staff, and your clients can always have the most up-to-date information available. The first of the 5 simple steps outlined in the worksheet, step 1, is to find out what year your home was built. If you own your home, you can consult the materials you received when you bought it. And if you rent, you can ask your landlord, who is required by law to disclose any lead hazards to you. If you need help talking to your landlord about testing for lead hazards or fixing any lead hazards that are found, your local health department or childhood lead poisoning prevention program should be able to help. Once you know what year it was built, if your child care home was built after 1978, you don't need to do anything, take any additional action regarding lead-based paint, but you should still consider posting that information for parents and staff so that they know you've addressed it. And you should definitely look into adopting the policies for lead in water, soil, and consumer products, which may still be a problem even if your home was built after 1978. If your home was built in 1978 or before 1978 and you own it, there are a few more steps you should take to reduce exposure from lead in paint. If your home was built before 1978, you will move on to step 2, which is to take action by hiring a certified lead inspector or risk assessor to help you determine if there is a potential problem. A lead-based paint inspection, which has an average cost of $310, though that may be a little more or less depending upon where you live, will tell you whether your home has lead-based paint, and if it does, where the lead-based paint is located in your home. A risk assessment is a different type of inspection. It is more expensive. It may cost anywhere from $800 to $2,000, but it will tell you lead hazards from paint, dust, and soil, and also tells you the actions to take to address those hazards. For help with this step, the U.S. Environmental Protection Agency has a tool to help you find a certified professional near you to help you assess your home. You can also call your local health agency or your nearest childhood lead poisoning prevention program to ask about free or reduced cost lead paint testing resources or any additional requirements or rules that are specific to your state. Links to these resources will be shown at the end of the webinar and are also included in the additional resources section of the implementation worksheet in the toolkit. Once you have your test results, share them with parents and staff. If you do have a lead paint or a lead hazard, the rest of the policy worksheet will help guide you in the steps to take next. If lead is identified in either the interior or exterior paint of your family childcare home, you will move to step 3. For this step, you should consult your state or local childhood lead poisoning prevention program, public health agency, and/or a certified risk assessment professional to write a remediation plan to reduce any identified hazards. This remediation plan may take one of 2 forms. The first of these is called interim controls. These are measures such as dust removal, paint stabilization, and/or control of friction and abrasion points to ensure that no one is exposed to lead-based paint hazards. Friction and abrasion points are places like windows or doors that open and close, or where surfaces rub against each other and may cause paint to wear faster and generate lead-contaminated dust. Paint stabilization just means repairing any defects that are causing the paint to deteriorate, removing any loose paint using only approved safe methods, and applying a new protective coating of paint. Regardless of what specific measures are used, if you take the approach of using interim controls, some intact lead-based paint may remain in your home, but it will not pose a hazard as long as it stays intact and isn't deteriorating. These controls have been found to be effective and are less expensive than full abatement. Full abatement, which is the other option, means measures that permanently remove lead-based paint from your home. This includes replacing components like doors, windows, and windowsills, and removing, enclosing, or encapsulating lead-based paint. Both enclosing and encapsulating lead-based paint mean putting a barrier between you and the lead-based paint so that you can't be exposed to it. This can be a liquid barrier that seals in the lead paint, or a durable physical barrier like drywall, paneling, or tile that is permanently attached to the surface like a wall, with all joints and edges sealed so that the dust cannot escape. It's important to note that regular paint is not an encapsulant. It won't seal in the lead dust, and that special training is required to do this work so that your family and the children in your care are safe during and after the renovations. It is also very important to work with your contractor to make sure that the people in your childcare home are safe while the work is being done. A certified professional will know to make this part of the plan, but you should still ask about it and know what measures are being used to keep everyone safe. As I already mentioned, interim controls cost less than full abatement because you're addressing and replacing fewer surfaces and components in your home. Of course, everyone wants to know how much each of these approaches will cost, but there are a lot of things that could influence the potential cost, and it's hard to predict without knowing the size of a space, how much lead paint there is, and so on. But I'd like to urge you not to let that stop you from taking action. I used to do a lot of work with schools to help them improve their indoor air quality, and sometimes the administrators would say to me that they didn't want us to do a walkthrough of their schools because if we found a problem, then they'd have to do something about it. And I understood why they felt that way, but I also worked with them to help them understand that not knowing was not a solution to that problem. Similarly, not knowing if you have lead paint won't protect kids from getting exposed. Start by getting tested. And if you have lead paint in your home, there are free and low-cost things you can do to start reducing exposure today while you figure out the longer-term plan of how to safely remove the hazards. State-level grant programs and local funding sources may also be available if you need financial support to have either interim controls or lead abatement done, but you can't ask for that help until you get your home tested. Once you have your plan, it is time to move to step 4 and start the work. It is very important that you use a lead-certified contractor to do any repair or renovation work so that you don't make exposures worse. That's another reason it's important to know if you have lead paint in your home, because sooner or later you may want to do some home improvements. And if there's lead paint and you don't know about it, or don't have someone who is properly trained to handle it, you can inadvertently increase the risk of exposure for everyone in the house. Because of this, the U.S. Environmental Protection Agency's Lead Renovation, Repair, and Painting Rule, also called the RRP Rule, requires that firms performing renovation, repair, and painting projects that disturb lead-based paint in homes, child care facilities, and preschools built before 1978 have their firm certified by EPA or an EPA-authorized state, use certified renovators who are trained by EPA-approved training providers, and follow lead-safe work practices. So you can ask the contractors you already work with if they have an RRP certification. Or the U.S. Environmental Protection Agency also has a search tool on their website to help you find a firm that is certified. So what happens after you've hired an RRP contractor and the work is completed? If your home was abated, that is, the lead hazards were permanently removed, then you don't need to take any additional action to remove hazards from lead-based paint after the work is complete. If interim controls were used, then you will need to keep monitoring the situation by doing an annual check. In either case, you will still need to make sure that there isn't any lead exposure from other sources like water, soil, or consumer products, because remediating your home for lead paint doesn't protect you or the children in your care from lead in these other sources. The last step in the process applies if you fixed a lead paint problem using interim controls. As we've just mentioned, annual inspections will check to ensure that the lead-based paint remains intact and hasn't become a hazard since the last inspection. The worksheet can help remind you of actions you should be taking to keep you and those in your care safe from lead-based paint hazards, including doing those annual checks, but also free and low-cost things like routine vacuuming with a vacuum that has a high-efficiency particulate air filter or HEPA filter, and cleaning window frames, windowsills, and railings weekly with a damp mop, sponge, or paper towel. The dampness is important. It helps to contain the dust better than a dry sponge or mop. And remember to take credit for all the work that you're doing to protect the kids in your care. Update the worksheet to list the actions you're taking and notify staff and parents at least once a year. Finally, the toolkit also contains links to several resources mentioned throughout tonight's webinar, where you can get more information about how to safely identify and address lead-based paint hazards as you walk through the 5 simple steps that we've outlined tonight. I'll call out the first 2 links on this slide in particular, as these are the search tools that can help you find qualified people to test and remediate your home. As I close my remarks tonight, I want you to remember that lead poisoning is preventable. We know how to find hazards, we know how to fix them, and help is available.
Thanks so much, Amanda. And of course, if you have questions, you're welcome to contact the folks at Children's Environmental Health Network or the National Center for Healthy Housing, and we'll do our best to get you the answers you need to take the first steps for reducing lead exposure in your home-based child care facility. If you already entered a question into the chat box during tonight's webinar, we'll be following up with you over the course of the next few weeks. We'll also remind you that the training certificates are available. Proof of attendance will be sent via email within 1 week of this live webinar. Please check your junk or spam email folder, as it often gets automatically sorted there. If you haven't received your certificate within 1 week, please email Nicole at NAFCC at conference@nafcc.org. If your state's agency accepts the training, you can submit your training certificate to your state's professional development registry. If you're working toward NAFCC accreditation, you may include this training along with your NAFCC accreditation application or NAFCC update. Please contact NAFCC for more information about training hour requirements. And thank you so much for joining tonight's webinar. We hope that you'll join us for the next webinar in this series on Wednesday, April 15th, which will cover lead in drinking water. Today's webinar and all of the webinars in this series will be available to watch as recordings at the link on the next screen. Thank you again for joining us, and have a wonderful evening.